We will now begin our discussion of the flagellates. We will discuss 4 intestinal flagellates, 1 urogenital one, and 2 genuses that are categorized as blood and tissue flagellates. That would be the Leishmania genus and Trypanosoma. For the intestinal flagellates, we have 2 that are pathogenic and 2 that are non-pathogenic. Our 2 pathogens are Giardia lamblia and Dientamoeba fragilis. The 2 non-pathogens are Chylomastix mesnelli and Trichomonas hominis. Giardia lamblia is also known by 2 other names, Giardia duodenalis and Giardia intestinalis. So all 3 of those species names can be used for the same parasite. I will be using the term Giardia lamblia, but you will definitely see those other terms in texts. Okay, in my opinion, if you learn only one parasite in this whole course, if one parasite sticks with you, it needs to be Giardia lamblia. It has worldwide distribution and it is the most common intestinal protozoan parasite that we see in the United States. And there are definitely outbreaks of Giardia. This is very important for you to be aware of. It is transmitted by the direct fecal-oral route of transmission, and the cyst is infective, and it's infective when passed. So people get it by drinking contaminated water. It's also known as traveler's diarrhea or beaver's diarrhea or backpacker's diarrhea because people backpacking often contract it if they don't bring along their own bottled water. And it's also, I'm sure you know this, advisable to drink bottled water when you go overseas or go to another country. It's also transmitted person to person, and it is considered a sexually transmitted disease. So when else have we mentioned a parasite that's an STD? It was Entamoeba histolytica. So anyone who participates in anal oral sexual practices can transmit this from person to person. So the disease state of it, it lives in the duodenum and the small intestines. The troph attaches to the intestinal epithelium but does not invade the mucosa. So it has suckers that help it attach to the mucosa. It is self-limiting, but it can be a pretty debilitating case of intestinal issues, and it can last for about a month. And people have been known to have recurrences of it, you know, over the years. Now, the diarrhea is usually non-bloody, but it's described as being very explosive and foul-smelling. So really lots of gas, very watery, even greasy stools, because there's a malabsorption problem here. Because the parasite attaches to the intestinal mucosa, it's like it's physically blanketing the intestinal mucosa where you do all your absorbing. So it's reducing the surface area for absorption. So you get this fatty, greasy stool because you're not absorbing those things. And I'll never ask you treatment like drugs or anything, but just FYI, Flagyl is a common treatment choice. For diagnosing it, just like other protozoans we've talked about so far, we can see the cyst in the troph in stool. Just like all the other parasites, remember from one of the first lectures, we want to examine usually 3 samples over a 10-day period to positively rule it out. Besides feces, we can also test duodenal aspirates or the Intero test. So remember the Intero test, we talked about that with Strongyloides stercoralis. And thankfully, there's also an immunologic-based assay available where we can detect the antigen, the Giardia antigens in stool. So that helps for rapid identification. So what does it look like? Starting with the trophozoite. It is pear-shaped, and it's described as having falling leaf motility. So if you can imagine a leaf falling from the trees where it sort of sways back and forth and falls like that. It has bilateral symmetry, meaning if I were to fold it in half, each side is a mirror image of itself, just like our bodies have bilateral symmetry. The trophozoite has 2 oval nuclei with large central karyosomes. There are structures inside of it called axonemes, and these are bundles of proteins that constitute the central core of the flagella. And speaking of flagella, there are 4 pairs on the troph, so 8 total. Now, this is true for all the flagellates. You usually cannot see the flagella on the flagellates. So unless you see the trophozoite actually moving and can note the motility of it, you would think, oh, flagellates are really easy because you'd be able to see the tail, this whip-like structure, but that's not the case. Even in stain smears, you usually cannot see the flagella. And then there's that large sucking disc I mentioned on its front side of the body. Okay, the trophozoite is so fun to see, and it's actually kind of cute. This is described as looking like an old man with glasses or a monkey face. So this is very obvious when you see it. The 2 nuclei give it that eyeball appearance, and there's structures called median bodies that actually make it look like a mouth, like he's smiling at you. So very obvious teardrop shape with these big googly eyes, and the median bodies are dead giveaways for the troph of Giardia. Again, the flagella would help with identification, but you usually cannot see them. So this would be a stained smear. Again, teardrop, I see those 2 big eyes staring back at me. I know right away that that's Giardia. There he is again, smiling. The cyst is more ovally. It can have up to 4 nuclei. And because it also has axonemes, the flagella are retracted into the cell wall. So because of the flagella are in there and the axonemes and the median bodies, I always tell students it looks very cluttered inside of the cyst. It looks very compact and things are sort of all squished together. Like there's a lot going on inside of there. And of course, just like other cysts we've talked about, it's resistant. It can remain viable for months outside in the environment. And what you want to look for too is the cytoplasm that's pulled away from the wall, so it looks like a little clearing in between the cytoplasm and the cell wall. So this is a good picture of them side by side. The cyst, you can see, looks pretty different from the troph. We don't have that face shape like we had for the troph, but it's still, once you see enough of these cysts, they become very obvious to you. So a cyst usually has, like I said, it can have up to 4 nuclei, but it might just have 2 or 3. And remember, fine adjustment is key here, where you thought you saw 2 and then you do fine adjustment and then 2 more pop out. So this is a really great picture. You can see the cell wall faintly right here, and you can see that the cytoplasm is pulled away from it. And these are what I mean by, these are both cysts. It looks pretty cluttered in there. It's not that nice bilateral symmetry. There, in this dimension, I can see 2 nuclei in each one of these, but if I had to bet, I'd guess there'd be more in there if I do fine tuning. Okay, so our other pathogenic intestinal flagellate is Dientamoeba fragilis. This is still being studied. Mainly its transmission is still unclear, but also its classification. It was an amoeba, but now it's considered a flagellate. So remember, which one of our parasites is an amoeba but has a flagellate form? Do you remember? That would be Naegleria fowleri. Dientamoeba is classified as a flagellate, but actually it doesn't have any flagella anymore. They believe that it used to have flagella, and when they do electron microscopy, when they look at it really, really closely, these scientists can see structures that revealed flagella or structures that used to be flagella, so they've decided that it's still considered a flagellate, but it's the flagellate without flagella. I know, so confusing. Okay, it inhabits the large intestines. Symptom range from asymptomatic to gastrointestinal illness. This one is also unique because it lacks a cyst stage. There's only the trophozoite. So what's the infective stage? The troph. What's the diagnostic stage? The troph. Remember, normally cysts are infective, but when there's no cyst, of course it has to default to the troph being infective. So like I said, transmission is unclear. They do believe it's fecal-oral route of transmission, and there are studies that suggest that it may, I call it, hitch a ride on some of our helminth eggs, like pinworm and ascaris. They've seen a lot of co-infections with people who have pinworm and Dientamoeba, or ascaris and Dientamoeba at the same time. So they think there's a correlation there. The troph is fairly small in size, and it has 2 nuclei. So if you remember the beginning here, di for 2, di, there's 2 nuclei. These nuclei have a handful of discrete granules around the karyosome, and the cytoplasm may contain vacuoles. This guy is so hard to find in the stool sample, and you'll see once you start looking at stool samples how this looks like debris. It doesn't really have defined borders, so it just sort of blends into the background. It's very blurry around here, so it doesn't stand out. And these 2 nuclei, that's really what I hone in on when I go looking for Dientamoeba fragilis on the slides. I look for these 2 nuclei that look kind of polka dotty, where I can make out a few granules making up the nucleus. So, and they're usually spread apart like that, where they do sort of resemble eyes. So that's helpful, that they're usually this distance apart. But otherwise, it's really, really hard to find this one. And again, is this the cyst or the troph? It's the troph because there is no cyst.